Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. Millicent Rovelo. I am here today with my profound and illustrious co-host, Dr. J. Calvert.
Feeling profound.
Profound.
Good to see you, Dr. Rovelo. That was good. That's your first tee off.
That was my first intro.
Very nice.
I feel like I put on like my deep voice.
That was good. You were very serious.
Like that.
And that was good. I'm into it. Happy to be here.
Good.
Happy to chit chat today.
What are we talking about today?
Well, since you're running the show, I'm going to leave it to you to talk about labiaplasty.
Labiaplasty. So labiaplasty is surgery of some kind to the labia, and it can be the labia majora, which is the outer part of the labia in women, or it can be the labia minora, which is the inner part of the labia in women.
Right. We're talking about definitely pelvic surgery in women.
In women. Not to be confused with labia, lips. We're not doing surgery of the lips of the face.
These lips.
No, not the face lips.
Yeah.
The labia in women. Men, sorry, this one's not for you.
Well, they may be interested because there's a lot of problems that can lead people to want a labiaplasty, and the men may be the ones that dial in. For instance, one of the biggest issues is pain with intercourse, and so men may notice with their partner that they're having pain or something and could ask about it. So I don't think the men should tune out completely, but this is a real problem, and I've done loads of labiaplasty over the years because it's kind of like an add-on for me, more so than a primary. Although I have had patients, as we were talking about, fly in for this operation with me, even though I don't even have a section on it on my website. But I do labiaplasty, probably every, 2 or 3 months. That it winds up where I'm doing this, that, or the other thing, and it's kind of like, by the way, doctor, while you're there, can you take a look and see if you can help me with this? And it's usually, it doesn't have to be after children, but a lot of times after women have children, the labia get longer, they get stretched out, and they become a problem. They can show in bathing suits, they can be, just not cute. That's really what a lot of women say. It's like, it's not good down there, and I want to fix it up. And so there's a lot of options in terms of doing labiaplasty and monsplasty, which kind of goes with it. The mons being the skin above the whole vulva area where you can just get kind of puffy or not.
I think it's called a fupa. Are we allowed to say that?
You can, but we're not going to define what that is. Google search it, and that's it.
And that's what it is.
By the way, I saw that on the OR schedule one day.
No way.
I swear to God, a fupa-plasty. Put on the schedule, and
that's bad.
I was like, "Do you know what this stands for?" And they're like, "No, it just got booked that way." I was like, "Oh my God, really?" So anyway, we won't define it.
We'll call it a monsplasty.
Monsplasty is the term that I use, and by the way, very, very great operation.
I love that one. I love that.
They're really important. In terms of female surgery, I think that these things are they should be talked about more, because while you're doing something else, like a tummy tuck and a mommy makeover, this can be a really key part.
This is very much part of it. And a lot of the reason is people just don't know it's an option.
Totally.
I mean, I'll talk with my girlfriends about it, and they say, oh my gosh, that's something that you can do something about. Or they'll be like, I never really thought about that. Do I need that? So there's a lot of just A, not knowing it's an option, or B, not knowing that it's even a problem. And when I say problem, I have to be very specific. When we're talking about problems, I'm actually referring to it as a functional problem, like you suggested. Pain with intercourse, pain with exercise. And this is because typically it's the labia minora, the inner lips of the labia, which protrude out from the labia majora. So they're sort of hanging out. They're a little bit longer than they should be in order to be comfortable. So they get stuck and they rub and they chafe, and it actually can be a problem,
for sure,
functional problem.
And a quick anatomy lesson for those of you who are kind of wondering what these terms are. So when it comes to the vulva, which is sort of the external aspect of the vagina, which is what many people just call it, like, it's the vagina.
It's the vagina.
It's not. The vagina is the birth canal, truly where the baby comes down and where, intercourse happens. So that's the vagina. But as you get into the vagina, there's the vulva. And this is the area of the labia majora, which are the external lips of the vulva.
Like where there's hair. You'll have hair growth.
Typically there's hair growth, right? And then the labia minora, which are hairless, and usually that's usually what gets long, and people have experience pain with intercourse and don't like that they're long and they show in bathing suits, etc. And then there's the clitoral hood, so the clitoris, which is a very sensitive aspect of the female anatomy, and then the clitoral hood, which can also be too much skin and need to be reduced as well. And any of these areas can be operated upon. In terms of and then above that being the skin of the mons, which can especially after C-sections, where there's a scarring. I think there can be not only is it just that the skin gets droopy, but I think there can be like lymphedema.
There is, and
I've seen this, and I've taken care of it. So you can wind up needing to do liposuction of the mons, a C-section scar with excision. And then doing, reduction, literally reduction of the labia majora, reduction of the minora, and then sometimes you got to bring in the OBGYN and do an anterior and posterior repair of the vagina itself. So all these things, are options in terms of rejuvenating the whole region of the pelvis, your labiaplasties, etc. The labiaplasty itself, though, is a great operation because it's pretty easy to do, number one, although there are some artistic points to it that I think are really important.
Yeah.
And I think, though, that the healing part is not terrible.
No, but you do have to dedicate some healing time for it. I have some people that think that it's not that big a deal and they can just hop up and travel or go back to sports, whatever. It's actually this area.
And have intercourse right away.
Yeah, no, this area needs a little bit of TLC. It's not that it's painful kind of recovery, but in order for these areas to heal well, they really kind of need to take a load off for a good week.
And I have them no intercourse for 3 weeks.
Oh, no, for sure.
Yeah, I mean, you gotta let this heal.
Yeah.
And
most women are on board with that. They're like, whoa,
yes,
what are you doing?
You should be on board because this area's got to heal.
Yeah.
But typically the care after surgery is pretty straightforward. I mean, the way that we do these just depends on what you need to reduce. And, the key is to not, some people think, oh, I'll just, snip
just
this
cut
off.
it off. Yeah.
You can't do that. You actually have to put a little Z-plasty in. You have to break up the scar. Otherwise you get problems because there can be over resection, which I've seen. You can have problems with, like you said, if you take too much, it can be like kind of open and chafed and that's not pleasant at all. But, again, with, good planning, good analysis and good planning, like all plastic surgery, you can have great results.
And the aesthetic goal, I mean, if you're talking about the aesthetics of it, we mentioned functional problems. The aesthetics that some women come in for, that's the only concern they have, is that you want the labia minora, the inner lips of the labia, to be kind of tucked in and hidden in between or beneath the labia majora, so that when you are in a standing position, you don't see them hanging. Now, I say that as a caveat because there are going to be people that hate and say there's no such thing as an abnormal labia, which is true. And if it's working for you and it's not causing problems, then your labia can look however they look, that's not a problem.
Absolutely.
But there are some women who just are self-conscious about that look, and they prefer to have them more tucked in.
That's right. It's it's all about what you like and what your aesthetic is, but the options are great, and the operations work really well.
Yeah, they work great. And the labia majora, I think, go hand in hand with the minora because a lot of times the age factors, so with age, the lengthening of the labia minora also goes hand in hand with sort of a shrinking of the labia majora. So this is an area that loses fat very frequently with age and with changes in hormones. So this is an area that's a great place actually for fat grafting and rebuilding and bringing back some volume to the labia majora.
Yeah, I mean, and some people want them reduced. Some people want them enhanced, and fat grafting of the labia majora is great. And it
that's a great procedure.
Really well. And it does, because when you lose the volume, it just looks like hanging skin.
Right. And it's uncomfortable. A lot of women say it's actually, I've lost volume there and it hurts to sit in certain positions. Intercourse hurts. So separate from the labia minora, just losing fat and volume in the majora can be an uncomfortable thing for women as well.
And clitoral hood reduction is kind of key, but you have to be careful because you don't want to,
take too much.
And this is a big issue. You really have. This is very artistic work, and It has to look great, and it has to be functionally correct.
No, definitely. But I think that it's when done well, like you said, it's a very satisfying procedure. It can be done as an add-on. I think it's a great add-on for mommy makeovers. If you're already in there,
Totally.
post-baby, having your tummy done or having the breast done, this is an excellent thing to add on. But it can also be done on its own. It can be done awake. I've done these awake, and patients do quite fine.
They do okay with them.
They come in, you can numb up the area with some topical cream, and then once that topic surface area is numb, then you can do some local injections. And by the time, that they're nice and numb, they're good to go.
Absolutely. And for me, they're a good add-on to a rhinoplasty because that's usually what I'm doing. So it's just kind of the way it works.
Yeah.
That's my practice. It's like an add-on, and what can you do? I think that knowing about it is
definitely half the battle. Getting that message out there. Knowing that there is no right standard way for a labia to look, but if yours are bothering you in some way, there are options to fix it.
Well, I think that about covers it. You have any other comments you got to put on that one?
No, I think we got it.
All right. Well, why don't you take us out since you took us in?
This is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.
The Beverly Hills Plastic Surgery Podcast is brought to you by Rock Spa. This is MediSpa, located both in Beverly Hills and Newport Beach, providing services such as Botox, fillers, lasers, and all therapy, as well as hydrofacials and all the aesthetic products you could possibly need. It's run by the medical director, me, Dr. J. Calvert. Rock Spa Beverly Hills is located at 120 South Spalding Drive in Suite 340, Beverly Hills, 90212. The phone number there is 310-777-0496, and Rock Spa Newport Beach is located at 1617 West Cliff Drive, Newport Beach, California, 92660. The phone number there is 949-644-1111. You can go to their respective websites, rockspanewportbeach.com or rockspabeverlyhills.com. Rock Spa was created to help my patients maintain their aesthetic beauty in between whatever operations they have throughout their lives. It's something that allows patients to come in, get their facials, skin treatments, take care of all the Botox fillers and lasers that they need to keep up their beauty. And if they've invested in any of the aesthetic operations I perform, it's the way to maintain those operations. If you mention this podcast, you will get the members' pricing for your hydrofacial. The Beverly Hills Plastic Surgery Podcast is the way that Dr. Rovelo and I talk about the issues that are important to us in plastic surgery. But there's nothing better than getting to take care of our patients and do plastic surgery. Our practices are located in Beverly Hills, and I also have a satellite office in Newport Beach. You can learn about my practice at drcalvert.com, and you can reach my office by calling 310-777-8800, and that will get you an appointment either in Beverly Hills or at the Newport Beach office.
My practice is located in Beverly Hills. Our office phone number is 310-954-1355. You can also contact us directly through the website, which is roveloplasticsurgery.com.
We look forward to seeing you in the office for some aesthetic tune-ups.